Thank you, Governor. As the Governor said, we continue to work with all 58 counties on a daily basis, supplying the data and information that we see at the state level around a number of different variables so that we are ensuring that we're in lockstep with those county leaders around what's happening locally and that we can support counties to improve situations that might need additional attention. As the Governor said, of the 58 counties today, the number of counties we're working with are 13. These are 13 counties for one reason or another. We have a little bit of concern about the data, and we feel like early and frequent engagement around what's going on locally with that added support at the state level, whether those are staff or ventilators or helping move some other patients into other counties to make sure that Californians get the care they need. And before I move on from this slide, we do always have what we call our step 3, instituting community measures, where we would work with a county where it's difficult to get an important measure into our expected control level, and that we would be able to work with those local leaders, local health officers who are every single day trying to make strong and good decisions for their counties in order that we put back measures that might be needed to ensure we get things under control and keep Californians safe. So this slide is, as the Governor mentioned, the slide that we look at every day. So on the prior slide, we mentioned 13 counties. This slide represents the counties as of today that have had 3 consecutive days of an area of focus or concern. This is in alphabetical order, not in necessarily best to worst or any other order. And you can see that we look at these specific measures, things that we've talked to you about for weeks, if not months, things like the number of tests per 100,000 people. We want at least 150 tests per 100,000 people. We want to see no more than 25 per 100,000 cases in your communities. We want to see a testing positivity rate that is below 8%. We want to make sure that the level of increase in your hospitals with COVID-19 positive patients is less than 10%. And then we want to see that the capacity both of the ICU beds and the ventilators stay above a specific threshold. And here you can see the checks on this table demonstrate where each of these listed counties is meeting the measure, and where you see a number, we are tracking that number to try to help support the county to get that number back in line with the measure. And so each day we use this information through frequent calls and meetings and conversations about resource needs and plans so that we can make sure as frequently as possible we're getting in front of issues early and trying to help support counties so that as we look to reopen, we stay very vigilant around the data points that matter, and we can support counties and make, in a very transparent way, the decision-making known to those citizens in that county and who are throughout the state. We update this daily, and whenever there are additional concerns, we have even more frequent conversations with our county partners.